Alright, so just a few tidbits on the National Registry test. We'll start with the trauma and medical assessment ones. You will fail if you don't worry about C-spine and scene safety and BSI, and that kind of goes for all the stations. For trauma, oxygen, have to have it, have to check your pulses, have to check your breathing, and a C-collar. For the trauma station, they will probably give you one major life threat emergency that you will have to fix within the primary assessment. And then when you do your head-to-toe rapid body scan, you'll probably find a secondary minor injury. Those injuries that are life threats possibly could be patient in shock, so pale, cool, diaphoretic skin, possibly a bleed, a rapid pulse. Treat that with oxygen and keep them warm. If it's a arterial bleed, the proctor will tell you that the patient has a major bleed someplace, and with your gloved hand, remember it's just direct pressure with the gloved hand, gauze, pressure bandage, and then right to tourniquet. The proctor will tell you rapidly that what you're doing doesn't work, and then you just go right to the next step. You verbalize tourniquet, and then the proctor will say bleeding has stopped. Then you move on to the next component. And rapid transport on your patient or slow transport, either one. For medical, again, same thing, scene safety, oxygen on your patient, check for pulse. The patient will have a pulse. It's either going to be cardiac or respiratory, and for the cardiac, you only have to give aspirin. For respiratory, you only have to give albuterol. And remember your 6 patient rights. Those will fail you if you don't mention those. And you will also fail if you don't mention that it's protocol driven. For the bag valve mask station, again, BSI, you have 30 seconds from go to get your first breath in. And that first breath can be a bag valve mask with or without the oral airway. You have to put them on high flow oxygen. You don't have to physically hook it up, but you have to state that, and you have to state that you're going to bag at 10 to 12 a minute. You'll direct your assistant to ventilate the patient, and you can assume that they're a trained EMT, and then you will put in your King iGel or Combi, going through all the steps. Make sure to verify lung sounds and open the epigastrium. And you have to secure the device. You have to verbally say that or physically do it. And then you have to state that you're going to continue ventilating the patient, and that will be the sign for the proctor to stop. Cardiac arrest, the AED station. Again, BSI, scene safety. You have to check for a pulse within the first 30 seconds of starting the scene, and for no more than 10 seconds. The proctor will judge you on your depth, rate, volume with each breath, complete chest recoil, your correct 30 to 2 ratio, and that you are minimizing interruptions to a minimum of 10 seconds. When the AED analyzes, they'll judge you that you stop CPR, and after you shock the patient, they will judge you that you resume CPR immediately. And yeah. For the spinal, again, it's either seated, the KED, or supine. So make sure you're familiar with both. BSI and C-spine are the biggest things on those that fail people. And the secondary failure on a lot of those is CMS checks. So do your CMS to nauseam. If you doubt whether you need to do it again, just do it again and get it over with to make sure you don't fail. Make sure you're familiar with how to measure and size the C-collar. The equipment that you'll use Tuesday is the same equipment that you've been practicing with. So the backboard will have the orange pads with the Velcro, and the straps will be the seatbelt style straps, and you'll have 4 of those. So the splinting station, again, it's either femur, shoulder, or tib fib. And again, BSI and CMS checks is ad nauseum, before and after, always. They'll judge you on just how you splint correctly, so you'll use the KTD, you'll do the sling and swath, and then you'll use the pro splint for the tip fib. And again, same things you've been practicing with throughout the class and this week. And I think that's it.